What made you want to become a veterinarian?
That's a good question, and you're going to be asked it like 1,000 times when you're applying to vet school. There's no good answer. The bad answer is because I like animals more than people, which isn't true because you have to deal with people a lot. The real answer is I just didn't ever think of being anything else. Since I was probably 10, it's the only thing I ever wanted to be. It's the only thing I ever considered being. I just couldn't imagine it. I knew what I didn't want to be. Like, I went to work with my dad one day and sat there while he was answering phone calls behind a desk wearing a suit, and I was like, well, that's not what I'm going to do. I am not going to have a job where I'm wearing a suit and sitting behind a desk. So now I wear a lab coat and sit behind a desk and stand behind a table. But the short answer is I never wanted to be anything else.
True, understandable. What was the hardest part about becoming a veterinarian?
The hardest part. None of it was easy. So getting into veterinary school is very competitive. There's about 3,000 people a year who get in. Probably, I think, about 30 vet schools in the country now, as opposed to about 130 medical schools. So it's much harder to get into veterinary school than it is to medical school. The first 3 years of college, I didn't have much fun. I just worked really hard and tried to keep my grades up and try to get a lot of experience in veterinary hospitals. Vet school is really tough. The fourth year of veterinary school is a lot of work. It's a lot of 20-hour days, a lot of sleepless nights. And that was probably the hardest part, what is the most fun, because it's the first time you actually got to pretend to be a doctor and actually got to treat patients and help them. Nothing about being a doctor, about understanding medicine, is beyond anybody. Anybody can understand it if they try hard enough. It's just the amount of stuff you have to learn is hard.
What type of surgeries do you guys perform here?
So we do neuters and spays, of course. Mass removals. We pull things out of dogs' stomachs that they eat. We do biopsies, amputations. We remove spleens. We go into bladders and get stones out of their bladder when they have stones. The only thing we don't do a lot of is orthopedics, so we don't fix the broken bones. We don't fix ruptured ligaments. We send those off to other surgeons. Things involving the mouth beyond pulling teeth we don't do. There's veterinary dentists who specialize in that. But as a veterinarian, you just have to be prepared to do anything at a moment's notice, honestly.
What's your favorite surgery?
Oh, God. Summer, what's your favorite surgery?
I don't know. I think anything that's a little different is fun. So foreign bodies are fun because when you pull the weird thing the dog ate out and show it to their owners, there's always this shock and amazement. That's probably my favorite just because, like I said, the owners are always a little amazed.
Yeah, you get to show them exactly what their dog ate. Pull it, like gastric foreign bodies where you go into the stomach and pull something out is always fun. I really like cystotomies, which is where you go into the bladder because it's kind of like, it's a little treasure chest you never know what you're going to get, and then you pull these nasty looking gigantic stones out of this tiny bladder.
Oh my God.
And it's kind of fun. And then, spaying and neutering is straightforward. It's cookie cutter. But it's nice and quick. So that's good too.
Do you remember the first surgery that you've ever done?
Yeah. Yeah, I do. I think we all do. So the first surgery I ever did, it was in vet school. You get put into a team of 3 people, and you rotate. So you get one person as the surgeon, one person is the assistant, one person does the anesthesia, and then you rotate the next week, and you spay a shelter dog. And my first dog was this older, gigantic black lab, and the spay took probably 3 hours to do because none of us knew what we were doing, and there's one professor for like 4 different tables, so you have to wait for them to come over and check every step that you do, obviously, to make sure you didn't do anything wrong. And like the first time you take a scalpel blade and cut into something, it's like a weird feeling. And most of what being a surgeon is understanding the feel of different tissues and how to handle them and what they can withstand and the right pressure. And the only way to do that is just to do surgery after surgery after surgery. So like later on in vet school, I went to a spay-neuter clinic, which is probably like the best thing you can do as a veterinary student. And in 3 weeks, I did like 200 surgeries, which is great because I came out of that really comfortable with how to do surgery. That first surgery, oh my God. Probably one of the scariest things I've ever had to do, but it worked out for the dog and for me.
Do you prefer bigger animals or smaller animals?
Bigger, like big dogs versus little dogs. Pluses and minuses. I think most vets are more scared of little dogs than big dogs. I have big dogs. I have like a 95-pound dog, a 70-pound dog, and a 50-pound dog. I don't have little dogs. Personally, I like the bigger dogs. I prefer dogs to cats every day, all day, all year long. But yeah, probably I like big dogs because I get to wrestle with them, push them around, and they're more fun to play with.
Understandable. How long on average does each surgery take?
It totally depends. So we'll do a neuter 20 minutes, super quick. You have some complicated surgeries, like if a cat eats a piece of ribbon, take like 2 to 3 hours. If you have to remove a piece of intestine because it got so badly damaged that it won't survive, those are like really long surgeries. So it totally depends. I've done like a dental cleaning where the teeth look great, they're just has tartar and gingivitis. It'll take 15 minutes. And then I've done some where I've had to remove every tooth the dog has because their mouth was so diseased, and that takes 3 hours. So you have to be prepared to not go to the bathroom for a while. Always go before surgery. That's the rule.
And what final advice do you have for anyone who's trying to become a veterinarian?
The more experience, the better. And that's true of anything in life. Free life lesson. Before you commit to doing anything, make sure it's what you want to do.
Yes.
Right? Because what you might think of as being a veterinarian is not at all what being a veterinarian is like. Like, yeah, I get to play with puppies, and that's pretty awesome, but I have to do mean things to puppies too. And 90% of the dogs that come in here are scared, and they don't want to see me. A lot of it is dealing with people who are like genuinely upset. You have to know how to talk to people and how to communicate with them, how to explain really complicated, scary things to them in a way that they can understand and make them feel safe and comfortable about it. And that's all stuff you wouldn't really realize if you didn't work there. So getting in there, getting hands-on. When I went to vet school, they required that you have 1,000 hours of veterinary experience before you got in. Now that wasn't a stiff requirement because a lot of people didn't have that. But I think that is probably, even if they don't require it, something you should do. You know, you get to work during the summers, during breaks, and just make sure it's something that you're actually passionate about and that you can see yourself doing for the next 40, 50 years.